Gallego.
Thank you, Mr. Chairman. Thank you, everyone, for being here today and for your service to our country, whether by direct service or as a family or a service member. The testimony today illustrates the ways in which bureaucracy is failing our veterans, especially when it comes to veterans seeking mental health care. Personally, I have my personal experience with this. When I first got back from the war, I actually tried to go right to my VA and ask for services for PTSD, was rejected because my paperwork hadn't caught up, and then continued to try to get help, as well as many of my other guys that I serve with, and actually avoided therapy for almost 12 years after that, and luckily am now in and have been, but a lot of us missed some opportunities, I think, to really put ourselves on the right path because of VA bureaucracy back in the day, and this is 2005, 2007 time frame. So this is, as I say, this is very personal to me, and even now I still talk to my brothers in arms who are now also going through different levels of therapy and or rehabilitation. So thank you for the testimony you guys are providing, because this is obviously important. As well as also, I am disappointed that we didn't get someone from the VA to come and talk, because they could have brought us a very good firsthand experience about really what effective contracting looks like, as well as asking the Government Accountability Office about their assessment of the program last year. And I think that would have given us very good perspective, because we really need to look at this holistically. And for us veterans that use services, get PTSD services or other services, we know the best way to deal with anything of this nature is holistically. So, Mr. Golnick, thank you for sharing your experience seeking mental health care through the VA, and for the work you're doing with Forge Health. Did I say that correctly? Okay, just want to make sure. English is my second language, so sometimes I mess up things. I've also had the experience of seeking care, as I said, and dealing with the trauma of being told that you can't get help. And it's too common of a story among us veterans. It's our responsibility to ensure that veterans have access to timely, high-quality health care. And in your testimony, you said that, like, you know, the men that I was able to help catch in the first, months really of trauma were the ones we were able to recuperate and put on a good path. And those that we weren't has been a very long, trial out. You mentioned the collaboration between Forge Health and VA showcase the potential of VA community partnerships, but also highlighted some of these ongoing challenges. Can you speak more specifically about what you saw in terms of inconsistent implementation, and what solutions you would recommend be implemented to address these issues in particular?
Yes, Senator. Thank you for your question. I think, again, going back to what I had mentioned previously, there are some VISNs and some VAMCs that are very collaborative and work well within the system. If there's delays, if there is and there are some where they were basically told not to refer out, no matter what the case was, right? So I think the standard, how we fix this, in my personal opinion, is to figure out a way to standardize those standards across the system to where, okay, every VISN, every VAMC has the same exact standards on how they are going to refer out, the number of people they're going to refer out. I understand that community care costs money, but there's, again, Senator, when you have a veteran and you don't catch them in time, and then they end up going to the emergency room.
It becomes more expensive.
It becomes way more expensive, right?
Yeah.
So how do we go upstream to prevent that? And so I think that standardized practice across the VISNs and across the VAMCs really is an important piece.
So some of that is like, tech, but some of it is just like SOPs, that as if we used to do in the military, no matter what unit you were, you did the SOP, so actually you didn't have to have massive retraining, and there was at least uniformity across.
And unfortunately, you saw it from the VAMC, where the providers or the people that were referring out would say, hey, I'm trying to refer, I understand this veteran needs that care, but the VISN is telling us no.
Got it. And Naomi, did I say that correctly? Great organization. I really appreciate Disabled American Veterans. They actually helped me get my my VA disability rating. So thank you so much. But wanted to follow up on that. Totally lost my train of thought. Are there currently any standards in place to ensure that community care providers are adequately trained to treat these types of conditions? In your opinion, and also have you seen any specific instances where the lack of veteran-specific training standards have negatively impacted the quality of veteran care, at least from people that have been sharing with members, constituents of the DAV or other organizations?
Thank you for that question, Senator. Correct. There is a lack of training in community care. Currently, Community care providers are only required to have opioid abuse treatment training, and this is as far as compared to direct care. So there's a difference between what the direct care providers are required to have and the community care providers. And so this is why we believe that if you strengthen the VA direct care, direct care, that then you would have better health outcomes.
And so community care, and I apologize, Chair, but so community care, sometimes there may be a veteran that goes but only ends up getting some treatment specifically for opioids, but not, for example, trauma, deep trauma, or anything else of that nature. So there's probably a mismatch at that point. And what you're saying is there's probably a better investment in direct care, or potentially maybe also doing community care, hyping up community care, making them more accessible to traditional PTSD.
Where they would understand military culture.
Yeah.
Right, and so that's really where that opportunity is missed. Is you might have a veteran that presents before a community care provider, and they don't understand military culture, and they're missing the cues where this patient might actually be suicidal.
Excellent. All right.
Senator
Thank you,
Tuberville.
Mr. Chairman. Yield back.
Thank you, Mr. Chairman. Ms. Martin.